How did Castro's reforms impact healthcare in Cuba? Have you ever wondered how a country's leadership can change the way healthcare is delivered? Let's take a closer look at how Fidel Castro's reforms transformed healthcare in Cuba. Before the Cuban Revolution, healthcare was mainly for the wealthy. Most people struggled to access even basic medical services. High infant mortality rates and low life expectancy were common. The healthcare system was unequal, favoring the elite. When Fidel Castro took power, he prioritized healthcare as a fundamental right for all citizens. The government took control of all medical facilities, closing private hospitals and clinics. This shift meant that healthcare became accessible to everyone, not just the privileged few. The principle of universal health care was even written into the Cuban Constitution. The government invested heavily in training healthcare professionals. They built a vast network of primary care clinics, community hospitals, and specialized institutes. Medical education became widely available, leading to Cuba producing more doctors than it needed for its population. As a result of these reforms, Cuba saw remarkable improvements in health indicators. Infant mortality rates dropped significantly, and life expectancy increased. Infectious diseases became less common, and the literacy rate rose as education and health were linked. The country developed a strong primary care system, with doctors and nurses working closely with local communities. Preventative care and public health campaigns became standard practices. Cuba also began exporting medical expertise to other countries. Thousands of Cuban doctors and health professionals were sent abroad, especially to developing nations. This not only helped those countries but also provided Cuba with foreign currency, especially during economic challenges in the 1990s. However, the healthcare system faced challenges. Resources were often limited, and the quality of care could vary. Some reports indicated that foreign patients and high-ranking officials received better treatment than ordinary Cubans. This created a two-tiered system within the socialist framework. Economic difficulties sometimes forced the government to prioritize earning foreign exchange over equal access for all citizens. From a socialist viewpoint, Castro's reforms turned healthcare from a privilege into a universal right. The state control allowed for centralized planning and rapid expansion of access. The focus on prevention and community-based care, along with the mass education of health professionals, showed what could be achieved when society prioritizes collective welfare. Cuba's experience illustrates how a socialist government can build a healthcare system that serves everyone, not just those who can pay. The emphasis on training doctors, integrating health and education, and exporting medical services are direct results of this approach. Yet, the limitations of resource shortages and inequalities in care highlight the difficulties of maintaining quality under economic strain. Overall, Castro's reforms reshaped Cuban healthcare into a model of universal access and state provision, leading to measurable improvements in public health while facing ongoing challenges tied to economic conditions.